Hello, doctors. This is Sorin from 32 Academy. I have the great pleasure to have with us today Dr. Ricardo Kern from Brazil. Hello, doctor. How are you doing?
How are you doing, my friend? Good.
Good, good, good. It's a pleasure to have you here. Long trip, but it's every time you come here, it's amazing. The entire dental community is just talking about you. It's talking about your presence here. So I can only congratulate you for that, and I'm feeling honored to have you with us for that matter. So it's really a pleasure to have you here today. I wanted to talk to you. Have a couple of questions for you. I mean, the dental community for sure knows you and know for sure you're professional. Some of them also know your personal maybe background. But I believe I wanted to take the chance today, as we have you here, to learn a little bit more about you, about Dr. Ricardo Kern. I wouldn't go so much into your personal life because that's yours. And first of all, I mean, you have a precision, an amazing precision on soft tissue. Everything was related to soft tissue. I'm curious, how did this passion started for you?
Okay, that is sometimes a few things in life happen just by coincidence, right? Talking my driving or my goals for periodontology, that happening still when I was university time. And all the time there is someone that inspires us. I have a very good professor at that time, and very early, still during university, that specific guy taught us how to do small surgeries, small crown lengthening, open flap to scrape root implanting. And when I start to do this small surgery, that is kind of catch me. For me, like, okay, that is my way. The blood, the blade, and the sutures, and kind of I really focus for being a perio, and I started planning to do the post-grad in perio as well. And so the passion started just because someone sometimes give you a good piece of information, inspire us, and I think it's is the way the world is being that ever.
Absolutely. Very nice. And I'm sure that you've been a model and a role model for many dentists throughout the world that attended your programs or watch you on online presence, and they discover, let's say, the passion for this soft tissue. And honestly, I think you can only be proud of that because it's as you said, it's the circle of life, and it's very nice. If we move one step back before starting the university, what drove you to choose the dentistry path?
Okay, good. I think before we really work as a dentist, we have not much clue how is the daily base of a dentist's life, right? You just can sometimes project an idea and imagine ourselves in that environment. I think it's difficult and hard for us to really have the real thing about how we're going to relate and perform doing the procedures from the dental procedures in sí. And I'm going to be very honest, the only thing that drove me or dragged me to be a dentist is to be my own boss, right? To have the days that I want to work, the way I want to work, to have my own office, the days that I want to chill out and take off. And to be honest, nowadays I work way more than if I was an employee, right? But that was, and that this lifestyle just really dragged me to be a dentist, and I was really realized how it is to work as a dentist a few years after graduated, and when you have the routine back again, right?
So your dream came true, definitely. Now you have your own practice, you have for sure your own team, and you're doing amazing things there. I was curious, how does a day of your practice looks like when you are not teaching but treating patients?
Yeah, that changed a little bit in the recent years. I think from 7 years from now, graduated now from 23 years already. So I established my private practice since that time. And the routine changed because in the beginning I was working in the full treatment of my patients, since the planning, since the prosthetical part, the surgery, the delivery for that, the follow-ups for the cases. I was doing everything, and that helped me a lot to understand many concepts from the surgeries. And today, with all the teaching or educational function that I do, I spend half of my time on the road or dedicated for that, and half of my time in the clinic. So first, I need to build up a very solid team for them to help me to treat this patient with the same philosophy of work, trying to be with the same quality. Guess that nowadays I think they are way better than me on the prosthetic delivery for my patient. But basically, when I get back to work nowadays, and is surgery all day long, right? We have surgery from the morning, 8:30 until 6 o'clock. I start and arrive 7:30 in my office, so I still have 1 hour for planning cases, have some small meetings with the team, organize something from the bureaucratic part, and after that is one surgery after the other one. I do not do any more much follow-ups for the cases, sometimes for the first appointment to plan the case, but basically is sit down and work in the surgeries that the patient deserve.
I hear you. Your own boss, as you said.
Yeah.
Well, that's the success. It comes with the responsibilities for sure. You're talking about the university earlier and about how everything started for you. You're teaching in the university as well, if I'm correct, these days, or you're still teaching or no?
Not anymore.
Not anymore.
Right? When I leave the post-graduation, I finished the postgrad in Peru. I received an invitation to be as a professor of the same postgrad, very early for me to receive that invitation. And then I did my master's degree, and then I received another invitation for another university to open a new postgrad. And after 2-3 years after this is starting, many things was going on, super busy. Life was running as a train. And then I have my first daughter. And when my first daughter was born, I take a decision. Was not a tough decision. For me, it was easy decision that for a few period of time, I wasn't only dedicated for the office. That is the essential thing. I drop all the activities from lecture, be as a professor, connected to the university, and to my kids. And I did that for many years until I had the opportunity to be back teaching. That started slowly after 2015-16, and keeping this movement growing to establish what we have nowadays. And my kids now, they are 17, my daughter, and my son 15. So they are doing their own things. They don't want to stay with the father all the time, for sure. We still have good time. But it was a good decision that time to really dedicate this beginning of the life of my kids for them. That was
very nice. Maybe one of them will follow you, and maybe one of them will be, in 10 years, will be sitting with us here talking about dentistry.
Let's see.
Thank you, because we are here now as part of the Salama Implantology Mastership in Romania. We're already now at the second edition, already looking ahead to the following ones. I wanted to ask you, what advice would you give to a colleague that is looking to attend the Salama Implantology Mastership, of course, from your perspective and from your implication in the soft tissue management module?
No, perfect. First, I think Salama has put together a great lineup of speakers. It's rare for you to find exactly this quality of teaching. And I think mostly because Maurice has been connecting to many speakers all around the world, have seen everybody teaching, lecturing, and I know almost everybody that is in the same program. I have been seeing lectures. And one thing sometimes is know how to do. Sometimes it's teaching something. But when people do something special and know really how to deliver this information, that is when you have a great speaker. And from this lineup, to be honest, they are all great speakers. So I think the great differential of this course here is exactly on the sequence of the knowledge. And also, Maurice has done a great work selecting the pieces or the puzzles for having someone that work with implanted dentistry to the next level. All the small points connected together for people that want to improve. I think this course is really solid on that.
Absolutely. I mean, I fully agree with you, and I'm very grateful to have you and to have the entire team here because indeed, Maurice Salama put up a lineup that really shows the best out of each topic. So it's been a challenging on one hand, a challenge on one hand. On the other hand, the outcome was really fantastic, and yeah, it's really a nice program, like a 1 year program that you can just go through it, and then you have like every major topics covered with one of the best speakers in the world that really can deliver, as you said, because it's important to be able also, I mean, knowledge, it's one thing, possibility to deliver it in a way that could be really understood and took next day into the practice, it's another topic. And all of you in part of this program have managed to and you have the capacity to really deliver the information in a way that can be immediately put in practice. And that's definitely a big plus.
Yeah, it's a quality. Maurice has this eye for the critical on the analysis. We see that when you are having discussions during some presentations, he do very specific questions sometimes. Even if we post a clinical case, Maurice is the guy that noticed some details that nobody else sees. So it's. I think he brought this critical eye for building up this course as well. So
Nice.
that's the outcome.
Perfect. Can you talk to me? Can you let me know some of the changes in the evolution of the dentistry that you see forgoing now?
Okay. In a general way, maybe I can put that for the perio part and also for the rehabilitation of the patient. What you are seeing that the demand for being more precise in the results, more predictable in the results that you want to deliver for the patient is increasing all the time, just not by the perspective of the patient itself, but from, of course, the dentists. The dentists want to be more in the control of the process and the delivery as well. When you translate that for soft tissue, years back, we are doing our best to get in closer to something that seems like the natural frame from the gingiva in a natural crown. Nowadays, we want to really be sure that you have that. So everything or all the efforts done for the new techniques is looking that way. Yeah, but that is just the need, just what we need to deliver for the patient. But how to deliver that? And for me, the new techniques that having been developed in the recent, I think, 6-7 years, was based on the understanding of the physiology and the anatomy of the tissue. The barrier to do these small improvements in a technique that you already manage or develop a new technique is based on the observation of the physiology of the tissue. When I have the indication, risk control, how to improve better the performance of everything. Even myself, I see nowadays looking for the new techniques, more understanding the tissue, the physiology of the tissue than anything else. And it's amazing the number of new procedures that we have in the recent 6 years. Exactly for that, I think we have developed much more in the recent 6 years than the previous 30 ones. The basis always has been there. The literature, the understanding was old thing, but we are using much more this understanding nowadays to develop this. And that is creating new possibilities for me, for the patients. What I can say, precision. That is what we have nowadays, and probably not just a small group of dentists that can do this kind of process in a very well-controlled way, but the idea that the knowledge go and be spread in order for that to have regular base for dentistry. More people doing the right stuff and controlling the process. That is the idea, I think, for the future for dentistry.
Thank you very much for that. I do have one last question for you. You mentioned earlier, and we started to talk about the way you embraced the soft tissue management back in your university time. As I said, you have a big community in Romania, not only of dentists that are following you online, offline. What advice do you have for a young dentist that is at the beginning of his career? what advice would you give him? A friendly advice would you give him in order to be able to really make a stand out and make a difference in this field?
Okay, I'm not sure if I'm really in the position sometimes to give much advice because life has different passes and we find our own. But if I can collaborate with something, it's nowadays we have so much available, so much information available, completely different than in my early times. That for us to find different papers took sometimes weeks or months for us to find one paper. And nowadays we have so much information available. It's so rich the amount of information that someone can look for and absorb. But not just that. When you are treating your patients, you are starting to do the first procedures. One advice is do that as more intense as possible. Do the best that you can give any case, right? Sometimes you can do very well the case, sometimes far away from the perfection. Perfection is something that you cannot achieve. That is from nature. But when you get close to that and you do your best, the process is different. And if you get used for this process, you're going to learn a lot when you are every time treating and try to do your best. Why is that? When you put intensity in something that you do in life, you learn much more doing the same thing than you are just passing by. Right? When you do a lot of repetition, not much pay attention, probably in the end of the day you learn nothing. But if you do a single case, really there, concentrated, you learn much more for that case. So try to deliver the best every day, next day the same. And then this is not an exception, this become a process. And as the process goes, is in you now to be someone that all the time is try to work. I know that perfection is not reachable, but we try to be as closer to that for offer good treatment for our patients. That is the way to go if you want to improve and working with this kind of dentistry nowadays.
Thank you very much for that. It was really a pleasure to have you with us today, Dr. Ricardo Kern. I thank you very much for that. It's been amazing to talk to you. Thank you.
My pleasure. Okay, thank you, sir, for having me.
Thank you.